Our next speaker is Orlando Carcoma. Orlando Carcamo. I keep mixing up his syllables. He's the manager of patient access outpatient services, including pre-registration, registration, and admissions. He's currently the chair of the Leadership, Education, and Wellness Organizational Council, and also the management sponsor for the Patient Access Shared Decision-Making Council. He has 15 years of health care revenue cycle experience at Torrance Memorial Medical Center and certified in Lean, L-E-A-N management. I'll let him tell you what that is. I don't know. He started his career in ancillary services and was given the opportunity to develop management skills in a more revenue-based role within Torrance Memorial. Additionally, he's worked with specialty physician practices, helping to transition into hospital-based clinics, and in 2013 helped to design and implement an integrated hospital registration and scheduling management system. So, here we are, Orlando Carcamo. I think I got it right then.
Thank you, everybody, for being here tonight. That was such a great presentation by Dr. Miller there, and I'm glad she touched on a few of the things that I'm going to be touching on. And this forum tonight it's funny how life works. About a year ago, a couple of days back, my mother was going to try to navigate the healthcare system, and it's funny when you're on the other side of that coin. You know, I've managed the day surgery areas, and I've seen families come in for surgical services day in and day out. And but when you're on the other side of that coin and feeling the anxiety and stress, and you have so many questions about what's going to happen, what my expectations are. You know, for my mother, she thought she was going to have a major surgery and be able to go back to work in a week. And I was sitting there thinking, okay, Mom, well, you know, more power to you, but I think your expectation might be a little off, and just trying to navigate in general. You know, what is my insurance? What is this going to cost me? Some of the questions that she had. Who can I contact? Where are resources that I can? What resources can I access, so that I can get some more information on how to navigate some of these complicated things that happen to me while I'm prepping for my surgery. And then sometimes, you know, even before her surgery, she had to go to the emergency room. And, you know, in an emergency situation, you just want to go to the ER. But some of the things that you can do, some of the you know, things that you can prep are having your insurance card in your wallet, your prescriptions in your wallet, your medication list in your wallet, using your legal name in an emergency situation so that people don't get confused in the medical record. There's a lot of people that come to Torrance Memorial and other facilities, and staying consistent with the name that you use are some of the things that you may not necessarily think about. But we're going to get into that here now. So I'm on the schedule. What do I do next? I have so many questions, and some of those questions are, how does my insurance work? How much is this going to cost? Do I have to do anything before? What should I bring? Where and when should I check in? And why do I have to register? Okay, so Torrance Memorial is contracted with many major PPO plans, covered California. We have two major IPAs that we deal with here, Torrance Hospital IPA and Healthcare Partners. Of course, our beloved Medicare and our senior plans. Again, many of the large payers are Aetna, HealthNet, Blue Cross, Blue Shield, Cigna, tons of other payers that we see here. Now, one of the questions that my mom was hung up on, and I see a lot of families come in and say, I don't understand. Am I in network or am I contracted? I don't know what that means. Are my doctors going to be covered if I come here? Are the anesthesiologists going to be covered when I come here? Are there going to be any hidden costs? And knowing the terminology about in network and contracted, they're synonymous. That means that you're chosen provider, either your doctor or your hospital, has a contract with the payer that you've chosen. So HealthNet, Blue Shield, Blue Cross, Healthcare Partners, FIPA. That means that they have a contract to provide service for you. And typically going in network is going to be a lot less expensive than if you choose to go out of network. Now, one of the reasons I put this slide up here was because when we were looking at specialists to go to for my mother's surgery, was that it was being suggested that she go to a surgical ambulatory site that they contract with, but it was outside of her network. And that means that she would have had to have paid 50 to 60% of the co-insurance. So her insurance would have paid 50% and she would have paid 50% or 60% of that co-insurance. And so you always want to be an informed consumer when you're doing that. And it's so important to know about your insurance and what type of coverage you have. And that's why I wanted to throw that up there. You know, you have choices as a consumer of healthcare, and you want to take the opportunity to do some research on where you can go. And, you know, I ended up suggesting that we go to a facility that was closer to her because it was only going to cost her 20%. And when you're on a fixed income or you have a limited income, that's really important. That's, you know, that's secondary. That might be secondary to, you know, I want to feel better, but I want to feel better in a way that's not going to cost me my home or, you know, put me in bad debt. So again, in-network is always, in my opinion, a better option than going out of network, but some insurances do have the option to go out of network. Now, another relevant question that I'm frequently asked when patients are coming in to pre-register for surgery and getting prepared to do surgery is, how much is this going to cost me? Well, the answer is not as satisfying as you might like. It differs person to person and contract to contract. So with each contract, people, you know, the providers are negotiating a particular rate for that population of patients. But across all of the different payers, some of the terms that you might hear are copay, deductible, co-insurance, and max out-of-pocket. Now, max out-of-pocket is one of my favorites because that means that tells you how much you're going to have to pay out of pocket before your insurance company kicks in. So don't fret, there is a reprieve. You won't have to pay you know, huge amounts if you get a good max out-of-pocket. But some of the HMOs, you're going to see typical copays for ER visits. You're going to see typically surgical visit copays, and you want to be educated about how much that is. You know, if you have a chronic condition that is taking you to the ER a lot of times, maybe that's something that you consider when you're looking to purchase your health insurance. Or if your deductible is very high, you have a $5,000 deductible. You want to understand that is the cost that you're going to have to pay before your insurance starts kicking in at the co-insurance rate, which might be 80% that they'll cover and you cover 20%, or it might be 70-30, or it might be 40-60, depending on the type of coverage you get. So it's really important to be educated about what type of coverage based on your own care. So one of the things I was talking to my dad about the other day, he's in the market for looking at health insurance, and he has knee problems. And I said, well, Dad, you know, you may not want to go with the lowest premium policy because, you know, that's going to be your premium is going to be less month to month, but ultimately you might end up having to have surgery. And if you have a $5,000 deductible, that might be difficult for you to come up with. So those are all the things that you want to consider when you're looking for purchasing insurance and prepping for surgery. You know, if you're going to have surgery a year from now or 6 months from now or something to the effect of where you might be able to purchase new insurance, those are things that you want to consider. Now, another question that I get is, do I have to do anything before? One of the good things that we do here at Torrance, and many other hospitals do, is pre-register either in person or by phone, and they're able to collect all of your demographics and look at your insurance benefits and try to explain what it is that your out-of-pocket might be for that particular visit. Okay. Another thing is, you want to present for pre-testing screening prior to your surgery. So you want to come and see our pre-testing nurses so that they can do an evaluation of you for your surgery, and also if you need any blood work or x-rays or an EKG prior to your surgery, that helps expedite the day of, and also it helps to mitigate any reason you might have to cancel your surgery because your labs are out of whack, or we didn't have an EKG for you. Also, you want to follow any necessary preparations prior to your arrival. So you'll be working with your physicians to get ready for the surgery, and you want to make sure that you understand any of the preps that they're recommending. And if you have questions, always feel free to call your surgeon, your physician. You can call the hospital. We have so many resources here for patient education. Right across the way in our West Tower, we have HealthLinks that does a phenomenal job about putting together courses for folks, and some of the programs like our joint replacement program, they do a class prior to total hips, total knees, very informative for mothers that are looking to deliver. They have maternity tours so that you get familiar with the layout of the hospital and understand where you're going. One of the things that creates the most anxiety is when you're coming in for surgery, or you're coming in for a procedure that you're going to be, under anesthesia, or you might be staying a few days afterwards. You're thinking about all of the things. Oh my gosh, did I take care of everything? Do I have an advanced directive? Do I have my medications? Are my kids going to be okay? Am I going to be okay? All these things are going through your mind, and when you arrive, if you're lost, that just adds to your anxiety. So walking through the flow during pre-registration and pre-testing just helps alleviate some of that anxiety. So I really recommend that you take the opportunity to do that prior to a major surgical procedure. Another great question that I get is, what should I bring? So you want to bring in your health insurance card, you want to bring in your prescription, a list of medications that you're currently taking, a personal identification card. Again, I want to stress and underscore how important bringing in a personal identification card is, and being consistent with the name that you use, your legal name on your card, because that's how the hospital and providers identify you. In an emergency, if you were to come in incapacitated, we would be looking for your photo ID and looking at the name that's on your photo ID along with your date of birth to pull up any historical medical records so that we can treat you appropriately. And sometimes what we see is when folks want to go by, maybe their middle name is Rose, so they tell us their name is Rose, but their name is actually Catherine Rose, and that creates a layer of confusion in an emergency situation. And so it's so important to stay consistent and be understand that has impact on your health care while you're in the hospital or working with other providers. You want to bring either some kind of form of payment so that you can take care of your deductibles, co-payments, and deposits, a copy of your advanced directive or a living will, essential personal items like your glasses, dentures, hearing aids, all very important to bring with you so that you can see if you have to sign any forms or if somebody has to give you instructions, you want to make sure that you have the things that you need. Now, one of the other things that folks ask me, what shouldn't I bring? And that's a great question. Don't bring your valuables or heirlooms that if you would lose them, you would really hate yourself for, right? Or you would be very distraught about. Keep those personal valuables, those things that are very sentimental to you, at home so that they stay safe. Now, we do have a safe at the hospital, and many hospitals do have safes, but just for peace of mind, leave those types of things at home so that you don't have to worry about it. And where should I check in? So one of the things that causes anxiety on the day of surgery is, I've come to the West Tower, but I'm actually supposed to be on the opposite side of the hospital. Know the layout of where you're going to be checking in. Ask questions. You can ask your physician. Most of the surgeons know where you're going to be checking in. Pre-registration and pre-testing can tell you where to check in. So we have a few different locations. We have the Lundquist Tower for procedural events, and then we also have our day surgery area for procedural events. Know where you're going to be checking in and know the area that you want to park in. So we have 2 main parking structures, one in the East Tower and one in the West Tower, and so you want to just park to the closest place where you're going to be coming. Another big question is, why do I have to register and pre-register? So it's necessary and important to capture all of your demographic information every visit. So Torrance Memorial sees about 25 to 30,000 patients a month. And so that information changes, and we see patients year to year. And things like emergency contact, your advance directive, organ donation, your financial and charity care might apply at that point, and then also to explain your rights and responsibilities. There's so many good things that we do in registration to get you prepped. It makes the continuity of the day of your surgery so much faster and easier for you, and relieves some anxiety. And also it gets you in front of some people that might be able to answer some of the questions that you've been really dying to ask us about. How should I prep? What is going to be the cost of my procedure to me out of pocket, because we can help answer some of those benefit deductible questions that you might have. But it's always a good idea to come see us beforehand so that we can help prep you for a day of. That's it for my presentation. Thank you very much for having me today.
Starting on the questions. This one, I'm sure, is for Dr. Miller, because it was right there up on one of your first slides. What is PCP?
And my husband just came up and asked me that, and I cannot believe I didn't think to clarify that. Primary care provider.
Right.
So it can be a doctor, a nurse practitioner, it's just whoever the primary care is.
Okay. Interesting, there were actually 2 of the same question there. I think, but I'm not sure, I think this one is for Orlando. Can a patient know beforehand what something will cost?
That's a great question. So what we strive to do with our pre-registration department is to assess or do a cost estimation based on patient-specific benefits. So we look at your coinsurance, we look at your outstanding deductible and what your max out-of-pocket is. And for some of our procedural services, we can actually look at what the contract says that Blue Cross would pay, and then we could apply your specific benefits, and we can spit out a number. And it's an estimate, but it's a pretty close estimate about what you're going to be paying. Now, one of the things that you want to consider is that when you're going to see various doctors and you're having various treatments done, that number is in flux. And so that's why it's kind of hard to give a really solid number. So when you're going to see your physician, they're going to be charging your insurance company for the services that they're providing. And so then that bill's going to go out. And then you might go get an ultrasound, or you might go get a CT scan, and those bills get sent out. And so there's some delay between the time that you have those services and the time that the insurance company pays for those services. So we try to do the best that we can. But yes, to sum it up, yes, we can do that for our procedural areas, and we can try to give you the best estimate as possible.
Okay. Not quite sure who to address this to. It might be Mary Matson there, who's quickly running to her place. I will be having a procedure done at the hospital. I understand Torrance Memorial can provide transportation to and from the hospital. How is that arranged?
We do have a van transportation service. You can contact the hospital probably at the same number that you gave at the beginning, the 4711 number, to ask about van transportation.
Okay, thank you.
I think it was the 517-4711 number that Mary Lou mentioned. Yeah. They could give you information about that and what circumstances we can assist with that. 4711.
Okay, can someone, not sure who to address this to, the questioner says, please explain admitted for observation versus a regular admission and the coverage or lack thereof, I don't know, by Medicare for those two different things.
So those are the different statuses that a person might be coming in for. So I won't get into the clinical ends of what observation and inpatient coverage would be. That's something that you might want to speak with your physician about. But there are different. So observation, Medicare would determine that as being an outpatient, and therefore the cost is a little different than being an inpatient. And so you might have an outpatient deductible that you need to meet with the observation services, and hopefully that's kind of what you were looking for as far as the answer. If not, maybe we can talk offline a little bit, but maybe maybe I answered the question there.
Yeah. I love this one. Can an advanced directive be in another state?
I believe the advance directive does carry over to a different state because it is a legalized document. It is notarized. The physician's orders for life-sustaining treatment, that's actually specific to California. So that does not carry over. Every state has separate requirements for their emergency protocols, but I believe the advance directive does carry over to different states.
Okay, I didn't write this, of course, but I could rephrase it and ask, I'm assuming what they're saying really is, if you've had an advance directive that was written in another state, does it still apply here?
It does.
And I think you're saying yes. But obviously, the hospital would have to have a copy of this to know what they're being directed, right? Yeah, so no matter where it came from, right? Okay.
Do you mind if and this is a good a point, whenever you get your advanced directives and your pulse, a nice thing to do is a copy goes to your primary care, so it's in their chart, a copy goes to medical records at the hospital. So that way you'll have one, but everybody else that needs to look at it gets one too.
Okay. Finishing up with a couple of challengers here. My gastroenterologist / primary doctor retired last year. I was told that whoever is my new primary care provider can get my records. So far, my new PCP has not been able to get hold of my records. I want to get them myself. Where can I get my records? Or a better way I would also put it the other way. What's the procedure so that this person's records can be given to the new primary care provider expeditiously?
I'm going to take this question because we fight with this every day. This is what happens. You have to sign a release for records. That goes to your previous doctor's office. Gets handled by somebody who has to fax the records. Then those fax records come back to my office and then need to get into the chart. As you can see, there's about 5,000 different ways that the fax didn't go through and they thought it did. It didn't get faxed to the right place. You know, if you've ever used a fax machine, sometimes you hit the fax and you think it went, and then later on you get a little note that says, no, that fax didn't go. So there's a lot of ways that it gets dropped. One of the best ways is if you go to the doctor's office or you call them and say, you know what, I'd like to pick up a copy of my records so I can take them to my new doctor. And what I've started doing is when people bring me their records, I will take out of it what I need, make copies of that, and then I'll give you back your entire record. So once you have it, it is your document, and that way you can take it to whoever you need. This is a real big problem in healthcare, and you'd think in the computerized age it wouldn't be, but it is. And the patients get very frustrated, the doctors get very frustrated, and I don't have any good answers to fix it, but I can tell you there's 1,000 ways that it fails every time you think it's done.
Now here's two questions, generally on the topic of collaboration and communication. The more general one says, what if collaboration / communication is not initiated by my primary care provider? What do I do?
Well, of course, that never happens. You know, again, the collaboration that I like to ask patients for is, let me know. There's a lot of times I thought I was speaking the right language. I thought I had communicated something, and when it doesn't happen, I really do want to know, because that's the only way that I know, wait a minute, I have to fix something. It's kind of similar to the hospital saying we want the feedback from the patients, because a lot of times we think we're doing what's right. We just didn't get it. So collaboration means talking back and forth. So if your PCP isn't doing something, as uncomfortable as it might be, it might not be a bad idea to say to that doctor, you know what, I'm not getting what, you're not getting what I want you to do. Collaboration is that back and forth communication. It can't be one way. It just can't be. And I really, really want that for my patients, because I never purposely do something. It's kind of like being a parent. As a parent, we never purposely wanted to do something bad for our kids. But how many times do we do it because we just didn't get it? So a lot of times your PCP will be very, very appreciative if you simply say, you know what, this is what I wanted and I didn't get it.
And if I could add to that, one of the things that we're trying to work on as well is to ask questions of our patients and ask open-ended questions. So we don't say, how are you today? And then they just say, fine, I guess. But maybe ask, what is your greatest concern today? And, you know, one last question, that's a good last question before you go even. Or what other questions do you have? I have the time. Even if you have 3 patients stacked up, that'll only take another minute. But for us to leave that with the patient, I have time for you, is huge for patients.
Now, here's one that I think probably, Mary, I think is probably goes to you, but I'm not absolutely sure. Well, let's see. I want to rephrase this a little, because so it isn't, yeah. Here's a person that is trying to improve coordination and collaboration between doctors, in that this person currently has to bring all the results of scans and whatever to UCLA, since that person's specialist there has no access to Torrance Memorial's records. And they're trying to figure out how to get the doctors here and the specialist better coordinated together.
So I could start, but I think others will contribute to this for sure. So to some extent, as Dr. Miller said, we are, as patients, having to continue to advocate for ourselves and just make sure we have the med list and the other things that Orlando has said. But we're working towards, and the Affordable Care Act is helping us with that, and the state of California as well, where we are trying to get to everything electronic so that it can be shared. That's one of the tenets of healthcare reform. We're not there yet. We'll get there someday, but it's a bit of a painful process. So eventually that UCLA physician will be able to access these records, but there are some challenges around that, including the fact that most hospitals and providers have different electronic systems and they don't talk to each other. But we're working on it, and both state and federal government are on us to do that, and we're working towards that. I don't know if you
What
have
kind of a
anything.
timeline would you anticipate before things actually worked?
Is the Nobel Prize available, if I answer that correctly?
So just to add to that, one of the things that you might consider is going to the Medical Records Department, or HIM department is another acronym that they use. And although we are on different platforms, a lot of hospitals understand that there needs to be a standard type of document that gets sent electronically, and one of those things are called the continuity of care documentation, and that can get sent electronically. So you may want to reach out to Medical Records or the HIM department to see if there's anything that they might be able to do to send over that information to your specialist or to UCLA, so that it's a little bit more concise for that specialist or medical center.
And just so everybody understands, and I get this a lot from patients, they come in and see me with a laptop, and they assume because I'm computerized, we're all computerized together. We're still, it's no different than the paper chart world. My office has my computer. This office has their computer. UCLA Hospital has its own computer. Physicians associated with UCLA Hospital still may have a different computer. So there's still a lot of work where we can get to something called a health information exchange, where everything gets uploaded, and now you go to your little HIE button on your computer and you press that, and it will open up information that's available on that patient. That's where we're headed. It's going to happen. These are the pitfalls. Patients don't have to be on the HIE. They can elect not to have their records out there. And I've run across that already, and I understand this whole privacy thing, but patients don't realize that's real detrimental now, because when I press that HIE button and it comes up, patient is not enrolled, then I'm back to square one to try to figure out how do I get a hold of that test. So I throw that out because as we become more electronic, and you guys are being asked, do you want to participate in these things? You have to make that decision. Do I want to make it easier for doctors to know something about me? Yes, then I'm going to be part of HIE. But if you elect not to be, then you are going to, it's going to make it harder for us to get those records. Again, we're not there, but it's coming, it's building, and so that'll be a question. That'll be part of your collaboration. Someday someone's going to say, do you want to be part of something called HIE?
Can you define that, please? What comes to my mind with HIV
No, HIE, Health Information Exchange. And again, it's a way to link all different computers, and I'm not a computer person at all. But I just know that right now I have access to all the things that happen at Torrance Memorial Hospital, labs, x-rays, hospital stay, discharge summary. If I press my little HIE button on my computer, we've gotten that far advanced. But that kind of connection has to keep growing between all doctors' offices and eventually all different hospitals. And the goal with the Affordable Care Act is someday, if you're in the ER in Kansas, they will be able to access your records here in California. That's when we will finally be done fighting this whole battle of who gets records and when.
Here, here.
You know, as Dr. Miller was talking, you know, it came to mind. A lot of providers are allowing you to access their own patient portal, and with that, many of them have that continuity of care document that you need to transfer to different facilities. Maybe not necessarily the imaging, but the documentation. And I believe Torrance Memorial actually offers the CCD on our patient portal too. So that's just another resource that you may want to look into.
Okay, well, that is our last question, and I think our panel has done a great job.